Hi, everyone. Great to be back. Hi, Ange. How are you?
Doing well. How are you?
I'm doing well, thanks. My name is Sarah Stewart, and I work for the Henry Jackson Foundation for the Advancement of Military Medicine in support of the Consortium for Health and Military Performance, or CHAMP for short. And CHAMP is a center of excellence at the Uniformed Services University. I am the social health scientist with CHAMP and on the HPRC team. And I'm here with Dr. Angela Yarnell to talk about the importance of sleep for health, both for COVID-19, and also to help you meet, maybe some of those New Year's goals. Before we get started, I want to mention that what we'll talk about today are our own opinions and don't necessarily reflect the official positions or policies of the Uniformed Services University, the Department of Defense, or the Henry M. Jackson Foundation.
Great, thanks. So I'm a research psychologist in the Army. I was privileged to spend several years leading a team of military and civilian scientists at the Walter Reed Army Institute for Research in the Sleep Research Center, where we conducted laboratory-based sleep and performance studies. And while I was there, we launched a series of studies to collect real-time sleep data in the field. I've also collected data at the United States Military Academy on sleep, performance, and domain-specific leadership among cadets at West Point, and really glad to be here today.
Awesome. So let's start by talking about sleep and how sleep really impacts different areas of our health. From my end at CHAMP, we really try to look at things in the health field from a holistic perspective. So we use the total force fitness model to think about kind of those different areas of military wellness. And with that, if I think about sleep specifically, it certainly impacts all these different aspects of health, and vice versa. These different how you're doing in these different areas affect your ability to sleep well as well. So I think sleep is a really important topic. And then for me, especially, my background is in the marriage and family therapy field. And at CHAMP, I focus on creating sort of those more social health resources and relationship resources for the military community. So in my area of expertise, I think about definitely how sleep specifically affects relationships. And again, vice versa, the opposite of that. If you think about if you're in a fight or disagreement with your partner or spouse, you might not sleep so well if it's unresolved or if you're still feeling like that tension, or you're feeling worked up. And definitely, it can be simply tough to sleep maybe next to somebody that you're not feeling totally resolved about. And at the same time, I know, when I'm low on sleep, so if it sort of starts on the sleep end, then I tend to be a little bit shorter or snappier with my family and friends. So it has a big impact on relationships as I think about it, kind of from my standpoint. But I'm curious, with all of your expertise, how do you see sleep and how it affects, kind of all those different domains of health and functioning?
Yes, absolutely. There's no doubt that sleep impacts performance and physical and mental health. Insufficient sleep degrades our cognitive and our emotional processes like vigilance, decision making, critical thinking, and motivation. Poor sleep negatively affects health in both the short term and the long term. Especially the chronic sleep restriction has been linked to a decreased resilience to stress related disorders like depression, pain sensitivity, cardiovascular disease, diabetes, and even mortality. Conversely, getting good sleep seems to optimize or improve our performance. Individuals who get the recommended amount of sleep per night, which for a person age 17 to 25 is about 7 to 10 hours. These individuals have a better, more optimistic outlook on their experiences and have better social interactions. There's some growing evidence that demonstrates how if we get the recommended amount of sleep or more, so we're talking 8 to 10 hours time in bed, that actually improves our cognitive performance on vigilance and attention related tasks. Extended sleep like this can increase our vigor, and there's a couple of studies that actually point to increases in athletic performance with extended sleep. So we recently reported that increased sleep can also reduce pain sensitivity, and this was done in a laboratory study. For those of us in the military, getting insufficient sleep is an occupational hazard. whether it's an increased operational tempo or running 24-hour operations or shift work that's associated with the mission. Service members are one of the most sleep-deprived groups. That's why when we write about our science or talk to leaders in the field, we don't take for granted that they can just get more sleep because our lab studies say that they should. We have to think about the whole operation and equip leaders and service members with the understanding and the tools that are available to increase sleep within the constraints of the mission, as well as manage sleep loss and fatigue with countermeasures like caffeine. We know in the military that reduced sleep has been linked to safety risks, such as increased accidents and increased military-friendly fire incidents. And we also know that readiness of the force to deploy and conduct their mission is reduced due to effects of insufficient sleep on health. This necessity is one of the reasons why we pay really close attention to the role of the leader with regard to sleep. Given the military structure and the existing cultural norms, leaders can and should positively influence sleep for their subordinates using what we call sleep leadership practices. So not only is the amount of sleep obtained by leaders and their followers important for sleep quality, but whether or not the leader actually prioritizes sleep for their followers is also really important. We call this domain-specific sleep leadership, and it's been studied in the military context, and it appears to account for variations in sleep and unit climate that go beyond general leadership factors. Specifically, sleep-focused leader behaviors can help to decrease sleep problems among individuals during combat deployments. These sleep-focused leader behaviors include things as simple as asking about sleep habits, planning for and ensuring subordinates get adequate sleep, and encouraging things like naps and extra sleep and an early bedtime when possible. And then monitoring their subordinate sleeping environments and their use of substances like nicotine, caffeine, and sleep medications. Finally, I wanted to point out, though it should go without saying, that sufficient sleep is really important for leaders. Intact cognitive and emotional processes are crucial for leaders to be effective in the way that they influence others. And we know from studies that sleep-restricted leaders actually display more negative qualities, like being passive avoidant, versus non-sleep deprived leaders who demonstrate more positive qualities that are consistent with the preferred transformational leadership style.
Yeah, thank you. I mean, I think that's such a great overview, both about how sleep affects our health, but also definitely about how it affects specifically our military service members and, their leadership. So, it's a great summary to keep in mind about why sleep is so important, because I think we're quick to forget that sometimes. And if we think about kind of where we are now in the context of COVID-19 and how that's affecting our ability to get sleep, I know a lot of people's schedules are heavily disrupted. People are taking on lots of different responsibilities and stresses, and there's a lot on, folks' plates, and they might really be having trouble kind of getting that sleep that they need to be at their best. At the same time, and then the lack of sleep actually compounds a lot of those issues. It makes it more difficult to deal with that stress and can even affect, immunity. So what do you see as some of maybe the biggest challenges that we should be aware of around sleep right now, kind of in that context of COVID-19?
So the studies coming out right now about sleep changes during quarantine are very interesting. There's some reports that people are getting more sleep with potential positive outcomes. There's reports that people are getting more time in bed, but maybe no better sleep quality or amount of sleep. And then there's reports about worse sleep in certain populations, like the unemployed and frontline workers. And I think it'll be a little while before we can really disentangle the pandemic environment to identify specific effects on sleep or of sleep as it relates to COVID-19. But there are two bodies of literature that we can look at for some guidance now. First, as you mentioned, we know that the experience of stress can lead to insufficient sleep, and that there's no shortage of stress these days, especially with the pandemic. So managing that stress is key to getting more sleep. Managing stress could be its own series of webinars. So I think it would be maybe more important to talk about the second body of work, and that's the relationship between sleep and the immune system. So we've known for a long time that insufficient sleep impairs immune function. But in the last decade or so, we've really increased our understanding of how and just how badly insufficient sleep can affect us. From the most basic connection of poor sleep being linked to an increased susceptibility to the common cold, to a really complicated understanding of antibody responses to novel antigens. Bottom line, we know that poor sleep increases our susceptibility to infectious disease. In fact, habitually getting less than 6 hours of sleep per night has been associated with a reduced lifespan, increased vulnerability to infection, and a reduced antibody titer after vaccination. So, when we're talking about the possibility of contracting a virus like COVID, it's not unreasonable to suggest that being sleep deprived and then exposed increases our chances of contracting an already very contagious virus. Further, and maybe more importantly, studies have shown that insufficient sleep before a vaccination negatively impacts the body's ability to mount the appropriate response, and therefore potentially reducing the efficacy of the vaccine. In this case, it was antibody titers to the influenza vaccine. So, as the pandemic continues and as vaccines become available, people should be paying attention to the amount and quality of sleep that they get, maybe even more than ever before.
Yeah, I think that's a good reminder about, you know, that our context matters a lot too, and that keeping that in mind when we're thinking about our sleep habits. And if I really think more about kind of our context and how sleep affects us in so many different ways, I can't help but think about, where we are in the calendar year. We're kind of closing out January here. It's a new year after a particularly tough year on our health. I think we could all say. And it's about the time that people tend to be kind of reevaluating, making resolutions, and just looking at their different health habits. And what maybe they want to change. And I know that a big resolution for many is to look at their weight and whether or not they're meeting their weight goals. So I'm curious to hear a little about how you think sleep can affect those types of goals.
When you get less than 6 to 8 hours of sleep, your efforts to eat healthy and exercise can make your body less effective at burning fat and building muscle. Sleep deprivation can also affect your nutrition choices. Lack of sleep can make you feel hungrier, feel less full after a meal, make it more likely that you give in to eating treats that you're trying to avoid. And if you're tired, you might also be less likely to maintain your workout routine. And all of these little things can make it really challenging to reach your weight loss goals. I like to think about our overall wellness like a bank, and we need to make deposits into that bank when we can so that when the stress or the challenge comes, we have the resources to pull from. And sleep is one of those key resources. People often get overwhelmed with the you need to eat right, you need to exercise, the list goes on. But as I've just outlined, sleep plays a key role in each of those other behaviors. And so maybe you could start by prioritizing sleep as a step in the right direction, especially making a decision to prioritize sleep over unnecessary activities like Netflix binging or marathon Among Us sessions. Now, I'm not suggesting that those activities aren't good or that they can't help reduce stress, but in the grand scheme of all the hours in our day, we pay ourselves by getting good sleep first.
Yeah, absolutely. So, with that, what are some of those good habits that you could share? Or, like, let's say, give us your top three strategies to get enough sleep. What are they?
Okay, how about apps, naps, and caffeine? I think anyone that you ask can tell you that not getting enough sleep is a bad thing, that it affects many different aspects of their lives. But the reality is that very few people, even those people who make that specific connection between their sleep loss and decreased performance, actually make those changes necessary to get better sleep. So, one thing that I've seen work anecdotally and in some of our studies is for people to track their sleep. This can be done as low tech as keeping a record of the time that you went to bed at night, the time that you woke up in the morning, and whether or not you woke up throughout the night for a week or two time period. You may also want to note the effect that it has on your daytime sleepiness, caffeine consumption, mood, and or performance. So HPRC has a sleep diary resource for this purpose. You can see that pictured here. There are also higher tech options out there. There are watches that are designed specifically to measure sleep, which are available commercially, as well as cell phone apps. The key is to do the tracking for at least a week and to monitor the outcomes associated with good or bad sleep, especially if you're intentional about getting increased sleep, which for most people is actually just getting the recommended amount of sleep, which is 7 to 9 hours per night. But then you can watch for those effects, those positive effects. People who have done this will say things like, I yelled at my kids less, or I wanted to drink less alcohol, or I actually wanted to eat healthy and exercise. There's something about making these connections for yourself, that it's your sleep, your mood, your performance versus reading about it measured in others, that really helps people to see why they should want to make these changes, especially if they can see the positive results from increased sleep. Okay, so the second strategy is a little bit more controversial. There's this badge of honor in our culture, especially in the military. It's the sleep is a crutch or mentality, or I don't really need to sleep perspective, which is completely backward and flawed if you're referencing anything that we've talked about up to this point. So rather than brag about how little sleep we get, we need to start bragging about getting good sleep. Or if we think that we can go without sleep, we need to imagine how much better we could be with sleep and change that narrative around sleep and performance. And this is where I'd like to specifically talk about naps. But I don't actually call it napping when I'm speaking with leaders or service members. We call it strategic sleep opportunities. And the reason for that goes beyond being cute or trying to be effective in our communication, but to really understand that restricted sleep is a given in our profession. So as leaders, it's important to plan for periods of restricted sleep. We know that sleep banking is possible. That's getting increased time in bed before periods of sleep deprivation or restriction, that this practice can actually lead to better outcomes during subsequent missions, such that it takes longer for the effects of sleep loss to set in. Now, there'll be some to suggest that sleep banking doesn't work, but usually that's because individuals are paying down an existing sleep debt versus actually accumulating a sleep bank. So if you can't sleep bank, then getting sleep when possible is important. And the research on nap seems to be mixed, but it really comes down to timing. How long is the nap? How close is it to a regular nighttime sleep opportunity? Ultimately, getting more sleep is better. I should caveat these remarks with noting that there are pathologies associated with sleep. So similar to changing the narrative around sleep, if you think you have a sleep-related disorder, like you can't fall asleep most nights or stay asleep, or you experience excessive daytime sleepiness, you should talk about these issues with your healthcare provider. There are a lot of non-pharmacological interventions that are available to help you get more sleep, and then subsequently improve your daytime performance. Okay, so the third tip, speaking of pharmacological interventions, what about caffeine and other stimulants and sleep aids? I want to talk about one of our recent studies where we showed that, well, we know that caffeine can be useful to maintain alertness after periods of restricted sleep or total sleep deprivation. But recently, in one of our lab studies, we demonstrated that these effects of caffeine are limited after only 3 days of inadequate sleep. Further, we know that caffeine can disrupt future sleep opportunities, depending on when it's consumed. So its use needs to be really limited, which is another kind of counter-cultural perspective. Similarly, supplements like melatonin and over-the-counter medications used to increase sleep should not be used for extended periods of time without consulting a healthcare provider. This is another place where leadership can really play a key role in ensuring our service members are getting healthy sleep. So watch what you consume and how it affects your ability to fall asleep. This notion can be extended to your behavior as well. Limiting lighting from screens, which can affect our circadian rhythms, which then also affects our ability to get good sleep. So I guess it just goes back to my earlier point about prioritizing sleep. If you're intentional about when you are sleeping so that you get more sleep, then you'll be paying more attention to how your behaviors and the environment affect your ability to get good sleep.
Great. That is super helpful. I know I'll definitely be implementing some of those tips right away. I'm all about normalizing the nap, so definitely on board with that. Um, and this is also a good time here as we're chatting to talk about sleep habits, because actually at the Human Performance Resources by CHAMP initiative, or HPRC, we're in the midst of our Get Into Fighting Weight New Year's challenge. So this week we're on challenge number 4, which is to include sleep as a part of your holistic weight management plan. But on the whole, the guide is a series of 5 challenges that can be tailored depending on where you are in your health and weight management journey. And like I said, challenge 4 is really about how sleep can affect those goals, and offers, some more information on top of some of the topics that we talked about today on how to get the right amount of sleep for your health.
That's a great idea and a great resource.
Yeah, I think, it's always helpful to have something tangible that you can turn to when you're trying to achieve a goal. So if anyone is interested in more information on sleep strategies, or even how to address different challenges during COVID-19, or more information on Total Force Fitness or any of the different domains of health, definitely check out hprc-online.org. Thanks for chatting with me today, Ange, and thanks to everyone for listening.
Thanks, Sarah, and thanks, Military One Source.